This is Katie McHugh at the World ADC Summit with Carl Nising, who is a senior scientist at Bayer in Frankfurt. And Carl, you were just telling me about how you have just started working with ADCs 6 months ago, and I was wondering how that came to be, and so far, what your perceptions are of the drug class.
Mm-hmm. Well, I mean, first of all, I have to say that I'm located in Wuppertal. It's some kilometers away from Frankfurt. But anyway, my background is actually that I'm a chemist by training, and I started with Bayer like 4 to 5 years ago. And in a completely different areas, I was working in the crop science area, so working on chemical crop protection with small molecules, which is a completely different field, has nothing to do with ADCs or with medchem. And so since this summer, since July, I switched gears and came over to Bayer Pharma, and now became involved in the field of ADCs, which is of course a completely different field of work, and it's very exciting now to get involved in that and being here.
And so, are you dealing with the chemistry side of things?
Yes, so I'm responsible for conjugation and for toxophore chemistry within the ADC field at Bayer.
Okay, so you talk about toxicity. What kind of tox issues are around at the moment? What challenges need to be overcome when it comes with regard to toxicity and ADCs?
Well, I mean, I think the point is, and we could see today in the workshop here, or also in the ADC Summit, that as with any other cytotoxic agent, you might have, of course, tox issues in non-target organs, and of course, this needs to be addressed. And this is also something which is, of course, very interesting to learn about here, about what other companies are experiencing with different ADCs, and so this was really exciting to learn about today.
Okay, and so what are the next steps with regards to Bayer's overall ADC pipeline? Have you got any drugs that are going into the clinic soon, or?
Yes, so we have collaborations with Immunogen and also Genetics compounds which are in phase 1 at the moment. Of course, we have several compounds in the pipeline, several ADCs in the pipeline. The next steps will definitely be to push them forward and to see whether we can get them in the clinic as soon as possible.
Okay, and it seems, especially downstairs, there are a lot of people from loads of different companies, some very small, some huge companies, and a lot more people seem to be entering the ADC fray. Mm-hmm. Why do you think that is?
Well, I mean, my impression as somebody who has just joined the field recently is that this area of ADCs is really exploding at the moment. So there's a huge amount of knowledge which is currently created in all different companies, and so it's something which is growing at an extremely fast pace. And so of course everybody wants to gather information, to exchange information. So that's why probably there are so many people from different companies here.
And so do you think, with regards to innovations in drug classes, how hot do you think ADCs are as a promising or potential new class of drugs?
Well, I think today it was pointed out several times, and this is really the point, that ADCs do offer really significant advantage compared to classical chemotherapy in the way that you have less side toxicity, you have higher therapeutic index. So this is really something which, at least to my opinion, will bring us a big step forward in oncology.
Is there anything else you'd like to talk about? Is that it, or would you like to talk about anything else, or is that fine?
Well,
no, that's great. Thank you. I was wondering if there's something else you'd like to discuss, or no?
Well, if you have any questions, I mean,
I don't know. I guess we could talk about companies that you think are quite exciting that you've seen here, like new innovations that might propel the industry forward.
Yes, so I think what came out pretty clearly today was that, of course, the leading companies in the area are definitely like Immunogen and Genetics, who even yesterday and today presented very interesting data on their top compounds. And of course, these are, I would say, the leading companies, but I mean, there are also several companies like Genentech, or also like Pfizer, who are really investing quite a lot of efforts here, and so this is really exciting to also exchange with them.
And what do you think, obviously right now a lot of the really big blockbusting biologics are facing commercial pressures from biosimilars. Do you think that ADCs could be a way to circumvent that financial threat?
This is a very interesting question, and I would guess that we have to see in the future if that turns out to be correct. Of course, as you can see, ADCs are quite complex. I mean, you have a biologic molecule and you have chemistry there. And so it's a highly complex area, and this makes it, of course, very difficult to come in with generics. So, which doesn't mean that it cannot happen, but I think it will be quite difficult.
Yeah.
So there are chances that.